Вот тут не надо ничего жать, только тут.
Да.
Good morning, dear students. Let's start for second stream of foreign students. Our lecture dedicated to the trauma and traumatism. Subdivide of lecture. Notion of traumatism, traumas of soft tissue, crush syndrome and traumatic shock. Trauma is a sudden and chronic influence on organs and tissue of mechanical, physical, chemical, and other agents, causing damage of anatomical structure of organs and tissues and their dysfunction, which are accompanied by local or total reaction of the organism. Among reasons of death, trauma occupies third place after cardiovascular and oncologic diseases. In people up to 40 years old, first place. Classification of traumas. It exists many classifications, by the way, they distinguish acute trauma, chronic traumatism, and traumatology. Acute trauma. One moment, sudden action on organism by traumatic agent, calling anatomical or physiological injury, which accompanied by local or total reaction of the organism. Chronic trauma. Constant, protracted influence on tissue and whole organism by weak, monotonous, external irritative agents. What does it mean, traumatism? Definition. Traumatism is repeated traumas which affect certain groups of population, disposed in equal circumstance, conditions of their labor and existence. What is science traumatology? Traumatology is a science about reasons, diagnostic and treatment of injuries of human body. There are distinguished following types of traumatism. Traumas of industrial character. A. Transport. It means tram, railway, car. Everyday, sporting or athletic, and others, including traumas which received as a result of natural catastrophes. Also subdivides trauma on the industrial character, manufactured and agriculture. And intentional traumas, including battle trauma, ill-intentioned attacks, and attempt of suicides. By type provoked damage agent, traumas are divided on mechanic, chemical, electric, ray, physical, operational, and others. Dividing of traumas by character of damage is very important. They are distinguished by the open and closed traumas. There is a gaping of skin on mucous membranes wounds we call about open damages. The microbes can penetrate through the wound of skin and mucus, that is promote to development of early and late complications. If there is no presence of gaping of skin and mucous membranes wounds, by closed damages. There are also distinguished the penetrating damages, in the presence of which internal organs of abdomen, of skull, of joint can be affected and unpenetrated. If damage of tissue of only one type presented, we tell about simple trauma, and if different tissues are damaged, we tell about complex trauma. It means skin, muscle, and bone. Trauma is homogeneous, maybe, in those cases if it provoked by only one factor. If a trauma is stipulated by several factors, it means mechanical trauma with a burn, for example, it named the combined trauma, while the single moment lesion of various systems presented unnamed conjunctive trauma, for example, concussion of brain and in combination with fracture of bones. In picture we may see patient with combined trauma, mechanical injuries due to explosives and burns, patient in state of traumatic shock. Trauma can be direct and indirect. Direct trauma appears due to direct action of provoking agent. In indirect trauma, damage developing in distance from the region of provoking agent influence. Traumas also subdivide into single and plural, or polytrauma. Close damage of soft injuries are divided on contusions, tensions, ruptures, concussions, and squeezes. At the picture we may see blunt direct simple trauma of soft tissues in view of contusion of left shoulder. Very often contusions appear in combination with superficial abrasions of skin, especially as a result of tangentially directed force or due to falling down. Contusion, a bruise from Latin word contusio, is damage of soft tissues and organs without breach of skin or loss of skin integrity as a result of quick and momentary action of traumatic factor on the one or another part of a human body. Mechanism of trauma can be various, following the something object or blow. Seriousness of damage is determined by two main moments: character of traumatic agent, its seriousness, consistency, quickness of action, and type of tissues on which trauma acts: skin, muscles, fat, bones, and other. In the picture we may see distributed hematoma as a result of blunt direct trauma of soft tissues of the lower limb. Contusion of right femur and leg. Clinical picture of contusion. Characterized by appearance of pains, swelling, breach of function of contused organ or region. It can be observed the exfoliation of skin by the action of great force by tangent. It can develop the shock of paralysis, the contusion of great nerves, of region, which innervated by contusion nerve, by contusion of joint breach of its function, and by contusion of thorax and lungs, in view of cutaneous emphysema. This picture demonstrates large contusion of soft tissue with exfoliation of skin and intratissue hematoma by the action of great force by tangent. Treatment of contusion. Solution of treatment at first period after contusion is stopping of hemorrhagic tissues that achieved by guarantee of rest, raised posture, cold, and pressing bandage. On second, third day, when a contused vessels thrombosed, the warmth physiotherapy procedure are applied in presence of hematoma, sucking off, and introduction of antibiotic obligatory should be present. Three pictures demonstrated principles of contusions treatment. Necessitative components of this treatment: cold, locally, pressing bandage, and elevated position of extremity. Ultra-high frequency waves, one of the widely distributed methods of physiotherapy in treatment of contusion of a soft tissue. Tensions and ruptures. Tension, from Latin word distorsio, is damage of soft tissues which is provoked by the force acting like attraction, without visible breach of continuity of tissues. Partial breaches, incomplete rupture of tissues, are present in this situation. However, if the acting force exceeds the resistibility of tissues by such mechanism of trauma, then the full rupture of ligaments develops. Which tissue? Fascias, muscles, tendons, and nerves, usually. Modern method of medicinal visualization, MRI, demonstrate visible defect of tendon, Achilles tendon, with surrounding hematoma, marked by the arrow. MRI investigation with pseudocolor imagination. Clinical picture continue. Clinically, rupture and tension or partial rupture of ligaments is accompanied by appearance of strong pains, breach of motions. In tensions, active movements are limited in volume because of pain. In rupture, active movements are absent fully. Hemorrhages in soft tissue. Edema or swelling of joint. It can be determined fluctuation by a palpation as a result of hemorrhage. Typical view of ankle, affected ankle, tensions and rupture clinical picture. View of extremity in case of tension of medial collateral ligaments. Rupture of the left ankle joint. Visible post-traumatic swelling around the joint. Tension of lateral part of collateral ligament of right ankle joint, swelling of soft tissue, and intradermal hematoma. View of the right shoulder on the second day after indirect trauma. Sharp and strong overloading of muscles flexors of arm. Full ab rupture of long caput of the biceps. The same case, full ab rupture of long caput of the biceps due to indirect trauma, but view in a 1.5 month after trauma. Visible defect of right biceps. Tensions and rupture. Treatment. Part 1. Treatment of tension consists in guarantee of rest, application of pressing bandage, and prolonged immobilization of a joint. After resolution of hemorrhage, the third week, they pass to careful active movements, massage, and medical physical training. The punction and introduction of antibiotics are but delayed resolution. Ruptures of fascias are registered rarely and developed from the direct blow in region of fascia. The crack-like defect of fascia is appeared as a result that is lead to sticking out by the contraction of muscles. Treatment only operative. This schematical picture illustrated operative ligaments repair in case of full rupture or injury of lateral ligaments of ankle joint in view of sticking. Mechanical therapy in restorative period after surgical treatment in reason of rupture of ligaments of right knee joint. Next type of indirect trauma, concussion, from Latin word commotio, is lead to the significant breach of function of organs and tissue. Prolonged and strong vibration of upper extremities at first provoke the breach of functions, then lead to the morphological change in muscles, nerves, bones, which are expressed in a development of sclerotic processes, pains, limit of capacity for work, vibrational disease. Treatment, conservative measures, neurotrophic medicines, B group vitamins, therapeutic procedures, and massages. Squeezes. Squeezes is observed by squeeze of lively important organs, heart, brain, lungs, and other. Traumatic toxicosis, specific syndrome. Crash syndrome or traumatic toxicosis is a specific complex disorders of the organism due to decay of soft tissues, especially muscles of extremities, as a result of their durable pressing. It's happened by landslides, earthquakes, bombardments, railway catastrophes. Syndrome is appeared after the removal of the squeezing heaviness. Next colored scheme demonstrate main pathological shifts, pathomorphological shifts in development of the crash syndrome. Local pathogenic processes, main links of this compartment syndrome, swelling of muscles causing compression of nerves and blood vessels. Pathogenesis of crash syndrome. Pathogenesis has some mechanisms. First, action of severe mechanical trauma, compression of large nerves and vessels. Second, absorption of products of ischemia, biological active substances. Third, toxicosis as a result of absorption of muscle decay products, uric and phosphoric acids, potassium, myoglobin, creatinine. Fourth, loss of plasma. Fifth, disorder of hepatorenal function. The first place is occupied by insufficiency of kidneys due to obturation of tubules of kidney by absorbed myoglobin crystals. According to the late data, crash syndrome is the ischemic necrosis of muscles with the further development of acute cardiovascular and hepatorenal insufficiency. During crash syndrome, we distinguished three main periods. Early period of cardiovascular disorder, last maximum 3 days. Second, intermediate period of acute renal insufficiency, lasts up to 3 months. And late period of recovery or death, lasts up to 2 weeks. We distinguish four clinical forms of crush syndrome. Extremely severe. First form. Crushing of both lower extremities more than 8 hours. Second form. Severe. Developed if a crushing of one or both lower extremities lasts more than 6 hours, but less than 8. Third. Middle form. Crushing of one lower extremity less than 6 hours. And light clinical form. Crushing of one lower or upper extremity less than 4 hours. Clinical picture at the early period, part 1. After extraction of patient from the obstruction, his state during some hours can be satisfactory. But in the second 6 hours, severe shock develops. This shock based on hypovolemia, tourniquet effect, and traumatic irritation. Complaints in this period: impossibility of movements by extremities, weakness, nausea, and vomiting. In first, second hours, swelling appears, but characteristic features presented. It's hot, reaches maximum by 24 hours. Next day. Swelling is specific in view of vitreous edema. Not only fat tissue, but muscles are swollen as well. Tissues acquire wooden density. No pits stay after pressing on extremity. Sometimes swelling can be so sizable that one can't palpate the pulse of peripheral vessels. Clinical picture in early period, part 2. Movements by limbs are impossible. The extremity is red cyanotic, covered with spots and blisters, with limpid or hemorrhagic fluid. Sensitivity in zone of injury is lost. Blood pressure decreases. Sometimes vomiting, jaundice, pains in area of kidneys are observed. Excretion of urine decreases up to 5,300 ml per day. Urine is red or brown coloration. In blood, there is increased concentration of potassium, phosphoricum, myoglobin, urea, creatinine, increase of hematocrit, number of R and white blood cells, and hypercoagulation present. In intermediate period, this period is characterized with short lucid interval, after which symptoms of acute renal insufficiency become strongly marked. In view of anuria, opinion of protein, cylinders, and erythrocytes in urine, increased amount of urea, ions of potassium, phosphor, and hydrogen. General state become worse. Uremia causes morphological and functional disorders in all systems and organs, in view of peritonitis, pericarditis, hepatitis, etc. The late period is characterized with local symptoms, predominantly decrease of swelling, rejection of skin and muscles, sometimes fingers and segments of extremity, traumatic neuritis with strong burning pains, phlegmons, phlebitis, sepsis, atrophy of muscles, rigidity and contracture in joint, and anemia. Principles of treatment of the crush syndrome. First principle: liberation of patient from the obstruction. Second, struggle against shock. Third, struggle against loss of plasma and toxemia. Fourth, restoration of renal and hepatic functions and normal metabolism. Fifth, in the late period, timely operative treatment. First aid in crush syndrome. Removing a traumatic agent. Application of a rope. Immobilization of crushed extremity. And introduction of analgesics and analeptics in place of accidents. This picture demonstrates schematical application of rubber rope, measure of the first aid in crush syndrome. In a hospital condition, rubber ropes should be changed on tight bandage obligatory. At hospital, we should provide putting tight bandage on extremities, and express swelling dissection of skin with fasciotomy, Wounds should be tamponade with hypertonic solution of sodium chloride. Local hypothermia, in view of using ice bottles, should be provided also. In heavy cases, amputation of crushed extremity. Novocaine blockades. And in absence of vomiting, plentiful drinking. This schematical picture illustrated performing of fasciotomy in treatment of dull trauma of left lower extremity, combination comminuted fracture of both bones of leg and compartment syndrome. Continue principles of treatment in hospital condition. Introduction of blood and its substitutes and components. Amount of introduced fluid is determined by hemoconcentration, correction of hematocrit, and Howard diuresis. Urine is received through a catheter, normally should be not less than 50 milliliter per hour. Oxygen therapy, alcohol and bromides, forced diuresis, large doses of diuretics in view of Lasix and mannitol on the background of plentiful hydration. Administration of heparin and glucocorticoids. Antibiotics, hemodialysis, in hyperpotassemia more than 7 microequivalent per liter and hyperhydration. Photo illustrated procedure of hemodialysis in period of acute renal failure. Shock is a typical pathological process occurring as a result of disorders of neurohumoral regulation caused with extreme action in view of mechanical trauma, burns, etc., and characterized with acute decrease of tissues blood supply, hypoxia, and depression of organism's function. Main clinical symptoms of traumatic shock: emotion inhibition, hypodynamia, hyporeflexia, hypothermia, arterial hypotension, tachycardia in view of rapid pulse, dyspnea in view of breathlessness, oliguria. In common, most important three are presented: hypovolemia, hypotension, and hypoxia, especially hypoxia of brain. The base of any shock is a systemic disorder of circulation with decrease of blood volume and worsening capillary blood flow, which lead to disturbance of organs, work, and death. It's actually combined with relative or absolute blood loss. View of patient in state of traumatic shock. You see mainly abrupted trauma with a traumatic amputation of extremity, severe explosive trauma of trunks and extremities. Main links of pathogenesis presented in this scheme. Most important cell hypoxia lead to energy deficit and congestion of lactic acid with decrease of pH. Metabolic acidosis lead to the vasoconstriction and the pouring of peripheral failure of precapillary sphincters. Cell membrane dysfunction lead to the intracellular lysosomes release digestive enzymes with efflux of potassium and influx of sodium and water, and lead to the toxic substances enter circulation. And in conclusion, capillary endothelium damage with future destruction, dysfunction, and cell death. These main effects of inadequate perfusion on cell function. Stage of traumatic shock, pathophysiology. In initial stage, during this stage, hypoperfusional state causes hypoxia, leading to the mitochondria being unable to produce adenosine triphosphate. Due to this lack of oxygen, the cell membranes become damaged and cells perform anaerobic respiration. This causes a buildup of lactic and pyruvic acid, which result in systemic metabolic acidosis. The process of removing these compounds from the cells by a liver requires oxygen, which is absent. In compensatory stage, this stage is characterized by the body employing physiological mechanisms, including neural, hormonal, and biochemical mechanisms in an attempt to reverse the condition. As a result of the acidosis, person will begin to hyperventilate in order to rid the body of carbon dioxide. carbon dioxide and directly acts to acidify the blood and the removing in the body if the body is attempting to raise pH of blood. The baroreceptors in the arteries detect resulting hypotension, cause the release of adrenaline and noradrenaline. This cause widespread vasoconstriction, resulting in an increase in not only blood pressure but heart rate. Continue pathophysiological shifts in compensatory stage. Renin-angiotensin axis is activated and antidiuretic hormone is released to conserve fluid via the kidneys. Also, these hormones cause the vasoconstriction in kidney, gastrointestinal tract and other organs to divert blood to the heart, lungs and brain. The lack of blood to the renal system causes characteristic low urine production. In progressive stage, should the cause of the crisis not be successfully treated, the shock will proceed to the progressive stage and the compensatory mechanism begin to fail. Due to decreased perfusion of the cells, sodium ions build up within while potassium ions leak out. As anaerobic metabolism continues, increasing the body's metabolic acidosis, the arterial and precapillary sphincters constrict such that blood remains in the capillaries. Due to this, the hydrostatic pressure will increase and combined with histamine release. This will lead to the leakage of fluid and protein into the surrounding tissue. As this fluid is lost, the blood's concentration and viscosity increase, causing sludging of the microcirculation. The prolonged vasoconstriction will also cause the vital organs to be compromised due to reduced perfusion. In refractory stage. At this stage, vital organs have failed and the shock can no longer be reversed. Brain damage and cell death have occurred. Death will occur imminently. Shock is a complex and continuous condition and there is no sudden transition from one stage to the next. Classification of traumatic shock. According to the cause: traumatic, operative, anaphylactic, hemolytic, septic, cardiogenic, and burn. According to time of appearance, may be primary shock developing at the moment of injury or just after it, and secondary developing at 24 hours after injury and usually postoperative. According to phases after Pirogov, erectile and topage. According to severity of cause, maybe first degree shock if present at systolic blood pressure above 90 mm mercury column and pulse not more than 100 per minute. Consciousness is present, skin is pale, breathing is frequent, pupils gives a reaction to light. About second degree of shock, we tell if a systolic blood pressure from 70 till 90 mm mercury column. Pulse increase from 100 up to till 120. Consciousness is inhibited. Skin is cold and pale. Breathing is frequent and weak. Reflexes are inhibited. Third degree occurs is systolic pressure from 50 till 70 mm mercury column. Pulse fluctuates between 120 and 140-150 per minute. Consciousness is confused obligatory, skin is cyanotic, breathing is weak or chain stocks or tidal respiration. Pupils don't give erection to light. Fourth degree, if systolic pressure less than 50 mm of mercury column. Pulse filiform can be counted and its peculiarities can be described. Consciousness is absent, skin is pale or cyanotic, covered with clammy sweat, usmaul or bites respiration, pupils doesn't give erection to light. It's a state of pre-agony. For assessment of severity, Algover's index is used. Shock index by Algover. What does it mean? Shock index by Algover is ratio of pulse frequency up to systolic blood pressure. Normally, ratio is about 0.5, 0.6. In first degree of shock, about 0.8. In second, 1.2, 1.4. In third degree of shock, about 1.7 up to 3. And in fourth degree, more than 3. Basic problems of treatment and principles. First principle, cessations of torrent and nervous impulses from periphery and center. This problem is carried out by Novocaine blockades, sympathetic, paranephral, and subperiosteal. Second principle, decrease of excitability of central nervous system by the way of creation of absolute rest, prescription of morphine, bromides, alcohol, Asratian fluid, including content bromides. Third principle of treatment of traumatic shock, struggle with factors which are burden cause of shock. Large doses of solutions of glucose, blood substitutes, inhalation of oxygen, blood transfusion and plasma transfusion, and calcium chloride are introduced for a struggle with toxemia, hypoxia, loss of plasma and blood. Fourth principle of treatment, struggle with consequence of a shock, restoration of breached function, breached of hemodynamics, cardiac medicines, warming, transfusions, transfusion of erythrocyte mass, plasma and blood substitute solutions. All measures must be carried out complexly, simultaneously, and energetically. On place of trauma, it's necessary to stop action of traumatic agent, to arrest bleeding with a rope, to hit patient with a blanket, tear, or coffin, to perform an improvised immobilization. In indications, to carry out an artificial breathing, to begin infusion therapy. Necessity measures in ambulance, links 1. Temporary arrest of bleeding, anesthesia in view of blockades and narcotic, or maybe even narcosis with nitrous oxide, immobilization with any splint, intramuscular or beta intravenous introduction of circulating and breathing stimulators, and antihistamine drugs. Obligatory oxygen therapy. Intravenous introduction of blood substitutes. Putting aseptic dressing of wound in presented wound, or occlusing bandage in place of open pneumothorax. Undirect cardiac massage. In vital indication, orotracheal intubation or tracheostomy. To deliver the patient in hospital. Necessity measures in hospital. Complete rest, horizontal or Trendelenburg position, Novocaine blockades, narcotic and non-narcotic analgesics. Intravenous introduction of 0.25 solutions of Novocaine and antihistamine drugs. Pipolfen, Tevigil. Infusion transfusion therapy in view of intravenous introduction of blood components and blood substitutes. Stimulation of vascular tonus by vasopressors when blood volume is sufficient only. Removing of vasoconstrictors in small vessels by ganglion blockers. Should be checked up responsibility of vessels to alpha-adrenomimetics. Necessity measures in hospital continue, using of small doses of cardiac glycosides and central analeptics. Oxygenotherapy, artificial ventilation of lung. For normalization of metabolism, introduction of glucose solutions with vitamins, B groups and C. For removing of acidosis, infusion of 4% of sodium bicarbonate. For decreased permeability of vessels, use of glucocorticoids. And nota bene, don't forget please, no operative interventions could be performed in state of shock. This is central moment of my today lecture. No operative interventions could be performed in state of shock. Only one exclude from these rules. If shock supported by continuing bleeding, we should perform this only one type of operation with lead of these small aims to stop bleeding. And that's all. Understand? No operative interventions could be performed in state of shock. In the conclusion of my lecture, let's see some pictures illustrated main links for doctors' movements in investigations and treating patients with shock. Some stage in diagnosis and treatment of shock. Checking of level of consciousness on base of light pupil reflex. Responsibility of pupil reaction on the light. Indisability of spontaneous breathing. Start of apparatus artificial breathing or breath support. In presence of severe traumatic blunt thoracic trauma, complicated by pneumo or hemothorax, immediate applying of chest pleural drainage. Emergency physical examination of abdomen and pelvic region to reveal possible fracture of pelvis or blunt injury of abdominal organs. Support of activity of mainly important organs and systems, especially breathing, cardiac function, and brain activity, CNS functions. Constant permanent instrumental observation and monitoring. Special attention should be applied in patients with unconsciousness state. Simplest instrumental investigation in view of X-ray may reveal bony trauma. At the picture, fracture of neck part of vertebral column. Head of fascial trauma, very distributed in patients with traumatic shock and polytrauma. Fascial hematoma may indicate injury of basal structure of skull and brains. Gaping wound of head, usually presented in victims after car-strong or battle street trauma. Besides pupil reflexes, in severe patient in state of shock, especially in suspicion of vertebral column trauma or head injury, obligatory peripheral reflexes should be checked. Pelvic injuries with accompanied breached functions of pelvic organs were very distributed in patients with polytrauma and traumatic shock and crash syndrome. And adequate transfusion of blood components and blood substitute solutions, necessitative components of treatment of traumatic shock and crash syndrome. This is all small information today. Thanks for your attention. Goodbye, my dear.